Supervisor Nelson.
Good morning. I want to inform everyone that the City Council did extend our all-in Amarillo order yesterday by 2 weeks and 2 days. So it will now match the governor's order for April 30th with regard to schools and hair salons. And can you hear me, Dave?
Yes, you're back.
Okay, sorry. I don't know what happened there. One of the pieces of data that was mentioned at City Council yesterday is we track all of our cases by age groups. And the 2 age groups that are showing the most frequency with positive tests are ages 20 to 29 and ages 30 to 39. So I want to ask you, if you know and love someone in those age categories, would you please have a conversation with them about sheltering in? I think it's possible that they're more of our essential workforce, and that's reflected in those numbers. But what I want to make sure is that they understand the seriousness of how important it is for us to all be sheltered in together. We're doing this together. We're doing this as a city. The more we participate and shelter in, then the quicker our city will be able to recover, both from a health component, health aspect, but also an economic aspect as well. And on economics, this week, all of the government stimulus checks are going out. So hopefully you and your family qualify for one of those checks. I hope that when you receive it, you will use it to support a local business in our city. If you are a business owner and you have not yet applied for the Paycheck Protection Program, a PPP loan, I hope you will do that. Actually, I'm begging that you will do that. We need those federal dollars to come into our economy and help us to cover payroll, but most importantly, they'll be available to help our economic recovery. So even if you think your check would be small, I'm still asking that you go through the proper channels to get your paperwork and to get your PPP loan so that we can have those dollars in our local economy as we come out of this and try to recover. That's what I have this morning. Thank you.
Thank you, Mayor. Now I want to go to Casey Stoughton, Public Health Director for the City of Amarillo.
Good morning. As of 10 o'clock this morning, there were a total of 160 cases of COVID-19 reported in Potter Randall County. Again, this is a fluid situation, so our numbers reflected in the 2:30 report card will likely increase. We have a total of 15 recoveries, which is certainly something to celebrate. We had some additional recoveries this morning and yesterday. The Public Health Department has preliminary demographic analysis related to race, and so I want to talk about that with you this morning. Currently, 51% of those tested are white, 37% Hispanic, 6% African American, and 6% Asian. Of the deaths reported to public health, 50% were white, 25% African American, and 25% Asian. I also want to remind our community that the only way to slow the spread of COVID-19 is to stay at home. We've talked about these things, I think, every press conference, and I think it's important to talk about them again. We need to maintain social distancing. If you have to get out of your house, please wear a fabric mask, wash your hands, stay 6 feet away from others. And if you're sick, please stay home. Contact your healthcare provider as always. Drive-through testing continues today until 3 p.m. So please call 378-6300 and our call takers will direct you to testing and screen you for appropriateness.
Hello? I'm not getting prompted to speak. Is it my turn to speak? Okay, that Casey's nodding, so I'll go ahead and get speak. I wanted to say that as Casey had mentioned, that testing is ongoing. I think our community is doing a good job of testing liberally, certainly when we compare those numbers to other cities in the state. As we've all said previously, please remember to stay home, and if you have to get out in the community, to use a mask. And the importance, once again, of using a mask is that there is likely asymptomatic transmission of this virus. And so this is being a good citizen. This is to help protect your neighbor in case you may be infected and not know it. There are some other forms of testing that seem to be becoming more common in the community that are mainly being used in the commercial setting. And these tests are antibody screening tests to see if, in fact, a blood test would suggest that, in fact, you may have been exposed recently or in the past to this infection. What we're asking, I think, at the health department is that, and we will communicate with the physicians in the community that have this test available, to please report that to us. I think it's going to be important as time goes on that we are able to collect that data for future reference. And that's all I have to say this morning. Thank you.
Thank you, Dr. Milton. Now I want to go Dr. Brian Weiss, Chief Medical Officer, Northwest Texas Hospital.
Oh, hey, good morning from Northwest, or I guess Northeast as my mirror image sign points. Let's start with some numbers. Right now we have 14 positives in the facility. That includes 3 in our adult ICU and then 2 in pediatrics. Then we have 22 patients who are persons under investigation. So a total of 36 patients right now who are COVID related. We have done, since March 17th, we've done 360 tests. And out of those 360 tests, 75 have come back positive. Now, it's got to be interesting. I'd say the Northwest experience thus far is that we're seeing a bit of a smolder, which is great. We're not seeing a peak. We're not seeing a fire in that sense, but just a slow smolder of positives has really allowed us to keep up with our resources. So that's fantastic. Now, as Casey mentioned about recoveries, we are very excited. We have a big celebration today. So the very first positive person we had today, a gentleman who came to us on March 18th, will be leaving the hospital at 2 o'clock today. And this man went through the ICU and a ventilator and through rehab. And we are extremely excited that he's going to leave today in great shape. So we're going to actually have a celebration walk. We're going to have our staff line the hallways, appropriately spaced, and we're going to see him out the door at 2 o'clock this afternoon. So that's huge. And so very, very beneficial. Great work by our staff, as all hospitals are doing with these patients. We continue to be a mask on at all times policy in the hospital. And we greatly appreciate a lot of donations of the cloth masks. The one thing we would ask is please, any of the cloth masks that are donated, please make sure they are consistent with the CDC standards and the standards that we actually have on our website. So you can go to our website. It talks about how to make an optimal cloth mask. And we are distributing those to any visitors and obviously staff who want to wear them outside the hospital. I want to continue to stress that we are starting to see more patients coming in with stroke-like symptoms or heart attack symptoms who are telling us, I've been having chest pain for the last 5 days at home and just didn't want to come in. Once again, I want to stress the importance of please don't ignore those symptoms that you think might mean a serious medical condition. We are taking extreme measures to protect people from COVID, as are the other hospitals, VSA, the ambulance service. Please come in with those symptoms so we can take care of you before you suffer irreparable damage to your health. And then lastly, so far, because we're just seeing this slow smolder, we're in good shape in terms of supplies and PPE. And I want to personally thank the Regional Advisory Council, who have done a great job of helping us obtain the PPE that we need. So far, so good in terms of we anticipate weeks of supplies now, given the current utilization that we're experiencing. Thank you.
Thank you, Dr. Weiss. Now I want to go to Dr. Michael Lamentier, Chief Medical Officer, VSA.
Good morning. Thanks for letting me speak today on behalf of BSA. I share Dr. Weiss's optimism that we continue to have patients that have come to our hospital that are testing positively, that have required a short duration of a hospital stay in some cases and are leaving in stable condition. And we're very, very pleased about that. I think that's consistent with what we're seeing across the country in terms of the majority of patients that acquire this infection do respond well with a good immune response and overcome the disease, which is what we all want. Our overall volumes at BSA in terms of the inpatient cases remain low. We currently have 4 cases here at BSA on the inpatient side. We have 13 patients under investigation. For the patients that are in our facility now that are positive, 3 of those are in the intensive care unit. I'd like to also report that our testing platform and the turnaround times that we've had have been much improved. We are seeing now really a 24-hour time frame for our test results to come back and help us then appropriately disposition those patients in terms of whether they're positive or not, and then how we proceed with their care during their hospital stay. We've been working very hard on a daily basis with our surge plan, with our executive team and our key directors in our facility in terms of the equipment that's needed for a potential surge, the bed space capacity with appropriate negative airflow rooms, the use of some additional construction to help accommodate potential surges, and then also the PPE planning. I agree with Dr. Weiss that because of the smoldering we've had of cases so far, PPE reserves are good. We are looking at some alternatives for things like gowns and those types of things for other hospitals in our system for Ardent. But quite frankly, here at BSA, our reserves are good. So we're helping to brainstorm on things to help other hospitals that are part of our system across the country, and also the organizations that are helping to come up with some of these alternatives are Texas-based companies that are making gowns that are really, I think, quite unique and should be suitable. We continue with the masking policy at BSA in terms of all individuals that are, we like to joke and say carbon-based life forms need to have a mask in the hospital. And that is that if you have the potential to spread this disease, we want you to have a mask on. It's just doing good due diligence in terms of preventing and helping diminish that transmission. And then lastly, I'd like to add that 2 things. First, that I would plead again with individuals in the community that have chronic health conditions, whether it be cardiac conditions or chronic pulmonary conditions. Please don't stay at home and be stoic if you're having symptoms that you think are a sign of your illness deteriorating. You need to seek medical care. You need to have your physicians make sure they're evaluating you, whether that's at the hospital or at those clinics. And you need to make sure that you're seeking appropriate care so that you're not having any kind of adverse health consequences as a result. I think Dr. Weiss would share my opinion that the risk of you acquiring COVID in the hospital, if you're not presenting as a patient with symptoms, is very low. And therefore, you should seek medical care in those instances. And then finally, with the collaboration with some of our lead physicians, Texas Tech, I'd like to mention here, and their efforts. We are working on a trial, and we are participating in a trial for patients to receive convalescent sera, which will allow them to potentially help contribute to the science behind what we can do to treat this illness in the future. And this is approved by our Texas Tech IRB, which approves a lot of our clinical trials, but also the overriding IRB here is the Mayo Clinic. So we're excited about that participation, and obviously we won't know the results of how these patients will fare, but it is an important effort in terms of moving forward with trials that hopefully will give us some more answers about how to manage this disease. And on that note, I'll end my statement today. Thank you.
Thank you, Dr. Lementier. We now want to go to Froy Garza of the Amarillo VA.
Hi, good morning. As of today, the Amarillo VA healthcare system still has 1 positive case in our ICU. However, we do not have any PUIs at the moment. And that PUI number does change daily, so I just want to put that out there. So as we continue to prepare for the influx of cases, we are happy to report that as of Saturday, we have started in-house testing for COVID-19. Since then, all our veterans tested have come back negative as of today, and our updated testing capabilities allow us to get results typically within 45 minutes. Among other recent changes, I want to remind our veterans that we have set up curbside prescription pickup for the following medications only: blood thinners, antibiotics, antivirals, and short-term steroids. This delivery option is available at our parking lot directly across from our emergency department. And please keep in mind that all other medication will continue to be mailed out through USPS. We're also continuing to transition 100% of all scheduled primary care, mental health, and specialty care appointments into virtual options. This includes telephone or VA Video Connect appointments. And already we've converted more than 7,000 appointments to this method. Only appointments deemed urgent by a VA physician will be scheduled for an in-person visit. This allows Panhandle veterans to stay home and reduce our exposure to the virus while still having access to the health care they have earned. I want to stress that should any of our veteran patients begin experiencing flu-like symptoms, have questions about their medication, or need to speak with their provider, please call ahead before visiting any one of our facilities at 806-355-9703 and press option 2. Again, that number is 806-355-9703 and press option 2. Our clinical team will assess your current situation and will provide you additional guidance. If you must visit us in person, please remember that we do have a mandatory 24/7 screening process in place before any person can enter our facility to ensure we are providing safe care for you and our employees in a nice, safe environment. In closing, during these challenging times, I'd like to ask the community to keep our residents in our veteran nursing home in mind. Every Wednesday on our Facebook page at VA Amarillo, our residents are sending personal messages to their loved ones, and I know they would love to hear from you. Already, students from Caprock High School have sent pictures back to our residents, letting them know they are not alone. Caprock High, we want to thank you for your kind words. In closing, I just want to recognize and thank the City of Amarillo, Mayor Nelson, and Public Health Department for allowing the VA to speak to our veterans and their families in the Texas Panhandle. Thank you.
Thank you, Foy. Now I want to go to City Manager of Amarillo, Jared Miller.
Thanks, Dave. Public safety calls for service remain down. Amarillo Police Department down 32%, Amarillo Fire Department down 26%, and EMS calls down 16% versus this time last year. Thanks to our community for practicing social distancing, doing your part to stay in and stay safe. With regard to low-risk businesses, the Governor's Order GA-14, which expires or set to go through April 30th, the same time that the city's order is scheduled to expire as well. It does order essential businesses to stay open. It does not, however, provide a lot of guidance on non-essential businesses. It does guide individuals to minimize contact with non-related people. The city's order does go a little bit farther than that to provide a little additional guidance on how a low-risk business or how a non-essential business can continue to operate. That is through the low-risk business status guidelines. Those are, I'm going to remind everyone, keep all employees and customers at least 6 feet apart at all times, never exceed gatherings of more than 10 people, take extra measures to sanitize common surfaces like countertops, carts, faucets, point-of-sale devices, and ensure employees and customers maintain enhanced hygiene practices. So again, that's up to the businesses to administer, to make sure that they are compliant with those criteria, and the city will report or will respond to reports or complaints that they're not. And what we'll do is we go visit with those businesses, and if we see or verify conditions that are not consistent with the criteria for a low-risk business, we will, one, teach them or guide them how to get there. Or if they cannot maintain consistency with those guidelines, they will be required to close down. The AmarilloAlerts.com. As a reminder, we've recently announced a new emergency notification system to provide current and factual information on a variety of events, including COVID-19 or possibly weather alerts, things like that. We encourage citizens to continue to sign up for this service at AmarilloAlerts.com so you can stay informed. As of this morning, we have 3,966 people signed up for these alerts. Really encourage everyone to sign up if you have the time. Finally, our testing center, our mobile testing center, our drive-through testing center. I want to remind everyone that the drive-through testing center is still open. If you feel sick and have symptoms you think may be COVID-19, call the public health hotline at 378-6300 to be screened for the drive-through testing center. Again, that number for public health hotline, 378-6300. We have people waiting to take your call and to perform your online or your over-the-phone assessment, and then schedule you and set you up for that drive-through test. That's all I have at this time.
Thank you, Jared. I want to go ahead this time and open up the questions from the communications department. These are questions that we've seen submitted to us through phone calls, emails, social media, sources like that. The first question would probably be directed to Mayor Nelson and or Jared Miller. When it can be safely determined that the city will no longer be under a shelter-in-place directive, can we see that far into the future to see how this process might open up the community? Will it be done in phases, or are we looking too far ahead yet? Do we know?
Well, I think one of the questions I'm getting most frequently in email and on Facebook is when can the city reopen? And I think actually a better question is how can the city reopen? And I think we need to begin to prepare as a city that it's going to happen as a transition. It's not going to be like a light switch where we just flip it back on and it stays on exactly like it was before. It's going to happen in stages, and we've got to prepare for that. We've got to be willing to expect some of the changes. When restaurants come back online, they're probably going to have fewer tables and be spaced further apart. I think we're going to need to prepare to wear a mask in public. We're going to go back in stages, and how we define that is still being discussed, and it's a bit of an experiment. We're relying heavily on our medical advisors, and I appreciate the people that are on this call that are daily analyzing that and answering these questions for the people making these decisions. But, right now we're trying to prevent the surge. If we can move into the next stage, which, hearing the doctors today talk about we're smoldering, that's our target. Then we can get into a stage where we're learning how to keep it suppressed. It's still happening, but it's not surging. And then ultimately, either through a long period of time of exposure in our community, or maybe through a vaccine, we have herd immunity. So, trying to manage those three stages, the surge stage, the smoldering or suppression stage, and the ultimate herd immunity stages, we're going to just have to check the data constantly and be monitoring that. So I want people's expectations to know that it's not a when, it's a how, and we're going to have to be prepared for doing things differently over the course of time, but we will eventually get back to doing life, I believe, the way we were doing it before.
Thank you, Mayor. This next question will probably be directed to Dr. Milton, although Dr. Weiss, Dr. Lamentier, feel free to join in. Is there a rough estimate of the percentage of people who may have COVID but have no symptoms at all, or mild symptoms? Do we know what a rough percentage might be?
I have not seen any data that points to a specific number. I've seen data that's suggested either from a small percentage of people to maybe even up to 50%. But I think it's a fairly good consensus that there is asymptomatic spread. I don't know if Dr. Weiss and Dr. Lamentier have any more comment on that.
I would say, the tough thing is we're seeing some patients who have really minimal symptoms, maybe a little bit of GI distress. The problem is they come in and get tested. Problem is those who don't know they have it don't come and get tested. So right now, until we have widespread testing, I completely agree with Dr. Milton. It's anyone's guess right now as to how many people are out there just don't know they have it and therefore aren't seeking tests.
Yeah, I would concur with that statement by both physicians, and that is that very mild symptoms may be the only manifestation of this disease. Some of the things that have been interesting, we've heard about some of the neurologic symptomatology that has occurred, lack of sense of smell, lack of sense of taste, sometimes are the only presenting symptoms in individuals. And I do not think that they are seeking health care in all those instances. It's a mild presentation, and therefore, again, back to what we've been saying is that we don't really know the denominator in this equation of the number of patients that are infected. Thus, to say that we have a certain percentage of our population infected, we just don't have that type of information to be able to convey an accurate number. We're only testing those individuals that are symptomatic, that present, and that's what we should be doing. But that also skews the ability to give an accurate number.
Which I think is why it's super important for people to maintain social distancing. We need to be wearing masks. We need to be washing our hands. Those things are very important right now with the with the asymptomatic transmission.
And that goes back into the stages of how we reopen the city. One of the ways we do it is we as citizens choose to believe that everyone we come in contact with is a positive case. They just don't know it. And that feels strange to us. But the sooner we can adopt that mentality, then truly the more quickly and more successfully we'll be able to reopen our city, because one of the components is how good are we at physical distancing? How dedicated are we to changing our hygiene habits, wearing a mask, and changing our culture for a little while to be more physically distant? That will determine the freedoms that we have in coming out and reopening our city more quickly.
Thank you, Mayor. We do have a series of questions that were submitted to the Communications Department from a nurses network via social media. I think most of these questions would probably be for Dr. Weiss, Dr. Lamentier, Dr. Milton. So I'll just direct it to you three primarily. Does Amarillo have sufficient access to equipment such as ventilators or non-invasive ventilation in the event we do see an increase in the number of hospitalized patients that have COVID-19?
I can answer that. So I would say yes, so far so good. And obviously Dr. Lamentier and I have been working together in terms of monitoring the inventory at the hospital. We have a multi-level tiered plan in terms of the ventilators, what we call anesthesia machines that can be used as ventilators. So yes, so far I think I can speak for Northwest. We're doing very well in that circumstance.
And I would agree with Dr. Weiss in that statement that part of our surge planning that I mentioned in my statement is looking at the number of ventilation devices that we have, whether it be the vents that were intended to be vents or those other devices that are used typically for a slightly different purpose. They can be made into ventilators for this purpose. I think we have a significant supply in our city, and we should be able to handle a significant surge. It's also interesting that the data around ventilator requirements and whether we should ventilate people more quickly or not seems to be fluctuating when you look at the expert panels across the country. I think both hospitals are trying things like high flow nasal cannula oxygen and attempts to try to stave off intubation if possible. We do know that when people get intubated, there's not a large majority that tend to do well if they have comorbidities. So we're trying to do the best thing for the patient, and I do think that we have adequate supplies.
At our current care requirements, right? I mean, at the level that we currently are suppressing, our supplies are adequate.
Correct. Again, if we're not continuing with the current efforts to socially distance and really do everything we can to mitigate that large peak in cases that could happen, that's where we're going to outpace our local community resources. So it's absolutely critical that we keep doing what we're doing and extending this through the end of April. And as Dr. Milton said, as Mayor Nelson said, it's going to be phases thereafter. It's not going to be turning on the light switch and saying we're back to normal business. That would not be advisable.
If I could just say, I absolutely attribute our current status to the tough decisions that Mayor Nelson, Dr. Milton, and the Public Health Department made early on in this. I mean, Dr. Fauci's always said you have to jump way ahead of this virus if you're going to mitigate the surge. And I don't want to jinx us, but so far we're doing all right. And I think those tough decisions are what have gotten us to this point right now. We just need to continue.
Thank you, Dr. Weiss. I want to go ahead and include Dr. Milton in this next question. Is there a PPE, personal protective equipment, shortage in our area? If so, what is being done to address the shortage if it's there?
There is not a PPE shortage in this area, and so I think that the health department is in discussion with the both hospitals on a regular basis about the PPE supply. And if that were to change, then certainly we can address that. But I think that I think we're doing okay. I don't know if the other doctors on the panel would want to comment on that as well.
I would agree. Right now, what we have seen, there are normal supply chain methods we are not getting PPE through those. But what we have done is got it through other avenues, including through the Regional Advisory Council and also. I agree, we don't have a shortage. It is a finite resource, and we have to monitor it and be careful with it. But we are certainly we're not in a shortage from Northwest perspective.
I would agree with that. At BSA, we are in good shape at this time with PPE. But again, it goes back to what the potential is for having a surge in cases. I don't think it's any surprise to make a statement that nationally we have a shortage of PPE. And again, I think that that's because of the pockets of areas in our country that are getting really bombarded with high numbers of cases. New York City, New Jersey, and we have some hospitals in New Jersey. Our system does. And the things that are being done to recycle PPE. That's because that finite resource is not in certain areas. But no, we are good now, and I anticipate we will be good. We're doing very, I would say, aggressive things within our system to make sure that we have an adequate supply of BSA, and also helping to supply some of our local facilities as well. I should say regional. We are also part of, and we are the division that includes Harker Heights, which is a small hospital system we have down near the Austin area, and we work with them to share supplies. And the graciousness of facilities sharing supplies and the donations that we've received, the help we've got from the Department of Health in certain aspects, and the Regional Advisory Committee. I mean, those are the things that really help us band together and get through this type of crisis.
As far as the VA is concerned, we too also have a really good, healthy stock of PPE in house. And I think we're doing really well with our conservation strategy that we enacted about mid-January or so. So we're looking pretty healthy on our end too. And we always reach out and support our sister facilities across the state as well.
Thank you, Foy. This next question, I want to go ahead and include Casey and Dr. Milton. When will Amarillo have the ability for more rapid on-site testing for COVID-19, do you think?
I think that testing is becoming more available even now. We heard from the VA that they have that testing available. We're hearing from physicians across our community that testing is becoming more available. And so I think that we're seeing that become more available even now. Dr. Milton, did you have something to add?
No, I think that's basically right. And it seems that as time goes forward, that capability is going to increase further.
Thank you, Dr. Milton. This question is primarily for Casey. How are positive test cases handled when a person is quarantined at home? Are there regular check-ins, medical support, things like that?
Yes, so we have a team that monitor all of our positives. We contact them daily, if not twice daily. So we check in with them. If there are any needs, then we help facilitate those needs medically or socially. So if they need food or if they need any other social supports, then we help navigate those as well.
Thank you, Casey. This next question, I want to include Mayor Nelson and Dr. Milton and Jared in there as well. What are the benchmarks to consider when the city determines if and when Amarillo can safely and efficiently return to normal operations? Are there certain criteria that would have to be present before that decision is made?
I would say that one thing that would be important is just to watch the data as it comes in. I think this is in many ways is going to be data driven, and so what we're hoping to see is that these numbers of cases will start to flatten. And we'll start seeing a flattening of the curve. And that's when I think that we would be I will be more confident in starting to loosen some of the restrictions.
Yeah, and I would tell you the things I'm thinking about and the things I'm asking our medical experts are, what's our testing capacity look like? Do we continue to have the ability to test anyone who's symptomatic? How many tests do we need a week? And for how long can we sustain that? What our demand is, does our supply match that? Are our hospitals and doctors' offices able to handle the current caseload that we have? I mean, we've got to make sure that every patient who shows up to get care is getting either hospitalization or treatment from their doctor without resorting to going into a crisis type care situation. The doctor mentioned a sustained reduction in cases. I think that's an important data point to be watching for. I think having conversations about how we're protecting people who are high risk. So once we lift a shelter in place order, there may be some people in our community that need to continue to shelter in place. And do we have a plan to educate them and to ask for their help to make sure that they're staying safe, recognizing they have a high risk, they're in the high risk category for either a severe case or mortality rate. And I think a lot of it comes back to us as individuals and the role that we play as citizens, as business owners, as kids attending school. Are we willing to practice physical distancing? Are we willing to wear a mask? Are we willing to consciously and intentionally wash our hands and keep our hands away from our face? That's something that I'm interested in watching. Are we committed to changing some things culturally in order to be able to open our city again? And I think also we're watching for new drugs and new treatments, the efficiency of how patients are recovering, as well as anything else that's slowing the spread. So that you can tell there's a lot of factors that I have in my mind for weighing whether or not we're ready to come out from under a shelter in place order.
Thank you.
Dave, I think the only thing I would add is as we go through all those questions that the mayor just talked about, and we will, and as Dr. Milton and Public Health, Casey, and all the rest of the team at Public Health, and all of our other departments that are working on this challenge, as we work with our peers across the state and federally, and also incorporate the guidance from the president, from the CDC, because there is going to be guidance and best practices established for this. We're going to review those, and we're going to modify those to best fit our area. We also want to make sure that as we discuss how do we roll back or how do we move back toward whatever new normal is going to be, we want to make sure that we're communicating with all of our regional partners, our regional jurisdictions, but also even farther than that, because we're all in this together. And as we begin to travel more and as we begin to work more, if one jurisdiction, it can be counties away, is premature or irresponsible in the way that they do it, it's going to have an adverse effect on all the jurisdictions around there. So we're going to try and coordinate that effort as much as we possibly can, understanding everyone's going to have different opinions on how it needs to happen. So that's why it's going to be important to evaluate best practices and how they fit in your jurisdiction.
Thank you, Jared. This next series of questions.
And we'll continue with this coronavirus coverage on air and online. And to keep up with the latest, you can head over to our website at myhighplains.com. For now, let's go and send it back to regular programming.
Is there any inspection or enforcement of the low risk category, or is this voluntary and self-reported?
We receive actually quite a few calls about businesses that are operating not in conformance with the low risk guidelines. So we investigate, or we follow up on all of those reports or complaints to see how that business is operating. If we witness or if we observe the conditions that were reported, we work with the business to get those, address those challenges, address those concerns. So we're following up on every call we get.
Thank you, Jared. This last question would be for Casey, primarily. In other areas, the African-American community is being diagnosed with a higher percentage of positives for a number of underlying reasons. Have we seen that yet here in Amarillo?
Not currently. Right now, the people who have tested positive, I believe, represents the demographic breakdown of our community. We'll have more analysis as we move forward, but right now, 6% of those people who were tested positive are African American, and so I think that fairly accurately represents the population. And so, but we'll have more analysis as we move forward. We do welcome people to be tested, and so if there are If there are people who would like to be tested, then we ask that they call our 378-6300 phone number, because we do welcome anyone to be tested.
Thank you, Casey. We now want to open it up to questions from the media. If you have a question for an individual panel member or the panel as a whole, that's okay. Just go ahead and state your name, who you're with. I think this is David Gay from the Globe News, if I'm correct.
Yep, you're right. Morning, guys. My first question is for Casey. Because the Public Health Department didn't receive any updated test result reports for yesterday's report card, does that say anything about the current status of the virus in our community, that there wasn't any new information yesterday in the report card?
No, we will have additional reports today. There was, the lab, the different labs, the timing of yesterday, of the way things happened yesterday, there just weren't additional cases reported to us, but we will have additional cases reported today.
Absolutely. I just wanted to check. And then my next question is for Dr. Weiss. It's a big deal that you guys are celebrating one of the cases or one of the recoveries today. How does it make you guys feel at Northwest to celebrate and this individual leaving the hospital after such an ordeal?
It's huge for us, David. I think when the evening that we received the positive result on this gentleman, you could see the anxiety in the hospital as the senior administration walked around and talked to staff, and that was a breaking point in the sense of, okay, now it's finally officially in Amarillo in our hospital, and to see this man now leave the hospital after all he's been through, just says, to me, the staff can feel reassured now that we can take great care of these patients and that they will do well, and the vast majority of them will do well. And so it is a moment to celebrate, and the fact that it's quite an accomplishment for him and for our staff.
Absolutely. That's all the questions I have right now, Dave.
Thank you, David. Let's go down to News Channel 10, and I'm willing to bet is this Ariana Martinez?
Yes, it is, Dave. Good morning.
Good morning. How are you?
Good. So for both or all PSA and Northwest, how many patients are currently on ventilators?
Right now,
Go ahead, Brian.
we have 3 in the ICU, but I believe only 1 is on a ventilator.
And Dr. Lim,
we currently have 4 COVID positive patients in the hospital. 3 are in the ICU, but only 1 of those is on the ventilator. Of our patients under investigation for COVID, 2 of those are on the ventilator. So that's 3 total, 1 positive and 2 pending tests.
Perfect. And then are we seeing it last a little longer when they're on ventilators? Is it taking about a month compared to 2 weeks, what we thought about earlier?
You mean the duration of illness, or
yeah,
I'm not sure I understand.
To see improvements, sorry.
I think that if a patient is requiring mechanical ventilation, what we're seeing, and we're seeing not only here, but nationally, is that those patients tend to have a longer hospitalization. That's not surprising. If they do develop the severe acute respiratory distress syndrome type of presentation, that can be the worst type of presentation for COVID, if you will. Those patients sometimes are on the ventilator beyond 10 days, closer to 2 weeks. And then those that recover at that time are extubated, and again, some can recover and do well.
I'd say I definitely want to echo what Dr. Lamentier said earlier, which is the data is telling us the more we can keep that patient off the vent, the better off they'll be. So there's really all kinds of strategies now to try to avoid that intubation, because when you do cross that threshold, as Dr. Lamentier said, 7 to 10 to 14 days is the rule for these patients, and that's what we've seen at Northwest. Is once they're on the ventilator, it's at least 7 days typically.
Perfect, thank you. And this is probably for Dr. Milton. Many are talking about the possibility of a resurgence later in the year. Is that even a possibility, or if it is, how do we prevent it?
Well, yeah, I think that it's unclear what will happen in the future, but I do think a resurgence is possible. And how do you prevent that? Well, you continue to practice social distancing and we continue to try to monitor the community, do testing as appropriate to try to mitigate that resurgence. So yes, to answer your question, it is a possibility.
Perfect. And then for all three hospitals, if a doctor enters a COVID positive patient room, do they change their PPE before entering another room, or what's the protocol on how much they change out their PPE?
I say absolutely. Yeah, if it's a COVID positive patient, absolutely. The PPE is put on before they enter, and it's taken off before they leave the room and thrown away. Even with patients under investigation, we want to be concerned about possible cross-contamination because there may be one person who has it and the other person who does not, but they're both under investigation. Even there, we're practicing safe techniques to prevent cross-contamination of those patients.
Perfect. And then,
Agree.
sorry. Continue, sorry.
No, I was just going to say I agree with Weiss's comment. The only situation that we've researched and seen nationally is if you have a COVID positive unit where everybody in that wing is confirmed positive, there is a strategy to conserve some PPE where all of the PPE must be changed going patient to patient. But for patients under investigation, you have to, because some of those are going to be negative and you don't want to cross-contaminate.
Perfect.
Yeah, and just to comment on that from the VA's perspective, we're following the same protocols as the other community hospitals. And again, we don't have a PPE stock issue at this point in time. So we're aggressively working our conservation strategy to avoid that.
Thank you, guys. And then at the VA, how is the hiring going?
Going really well. About 2 weeks ago, we had 36 new staff come on board, and we're continuing to hire weekly. So we encourage folks that are interested in joining up to serve our Panhandle veterans. We encourage them to visit our website at amarillo.va.gov or visit the usajobs.gov website for all the latest and greatest.
And at the VA, do you have kind of like a cap of how many you're looking to hire, or are you just kind of going with how many?
No, yeah. So as far as the as part of our surge planning for the level of nurses that we'll need, depending on how this ends up, we do have a staffing methodology that our teams have in place that we're trying to hit. It's rare that we'll hit that level occasionally, but for the most part, that's our goal, to try and get as close as we can to that level. And that's currently what we're doing.
Perfect, thank you. And then at BSA and Northwest, do we have better numbers of how many furloughs there are?
I can speak to that first because I brought that up last week. Don't have exact numbers. I would say that it's a very fluid situation. We're looking at what individuals can be furloughed now while we're having lower numbers, and those that can be pulled off immediately if need be for any kind of patient surge, especially those that are in direct patient care activities. And we're attempting to obviously minimize that amount of time, but also have those individuals take advantage of some of the governmental aid.
Yeah, I'd echo the same thing. As we talked about before, we've seen a significant reduction in our ED visits, a significant reduction in our number of patients in the hospital. And then, to me, the engine of the hospital is the operating room. And with the postponement of elective cases, our engine is kind of running slow right now too. So it's just, we do not want to lose any staff, but for the benefit of our staff, sometimes the best decision is allow them to seek some resources elsewhere while we maintain them and maintain their benefits, only to be able to bring them back full force when we get past this viral scare.
Thank you. And then the last question, I know on Monday we had no donations at this time, but as of today, do we have any donations of that plasma?
We're working on processing our recovered patients through the process that has been established. And so we look forward to seeing what those test results are so that we can get them processed from the public health department. I will let other persons speak to their plans, but.
Yes, I mean, as I mentioned, we're participating in that convalescent sera trial, and we are encouraging individuals to obviously donate blood. Those that have been infected and have recovered are obviously the candidates for potentially donating that sera, but even those that have not been infected with COVID, donating blood is a critical support for our local community, and we encourage you to do so.
So just to comment on that, as far as VA is concerned, we are also partnering with one of our sister VA facilities out of Boston for a similar trial. So we're looking forward to participating and seeing what those results have for us.
Perfect. Thank you, guys. That's all I have. I'll see you on Friday.
Thank you, Ariana. And we do have some other media members who are signed on. I want to make sure we don't miss anyone. Do we have a representative from KAMR Channel 4? Haley, how are you?
Not currently. We work, every case we work through a contact investigation, and that contact investigation information is located on amarilloalerts.com. So I think it's important to know that every positive receives a contact investigation. Our goal is to make sure that all food supplies stay open. And so did you have something, Ms.
Yeah, I wanted to jump in and just talk about, what we're balancing in the city right now is our health concerns with our economic concerns. And so part of the reason we did the all-in Amarillo order is to prioritize the health concerns. And the more we follow that, if we're not an essential worker, the better we're setting up our essential workers who are going to our meat processing plants, because we're not spreading it within our community. And so we're creating a safer environment for every essential worker, whether that's somebody in the supply chain, somebody working in the grocery store or food providing industry, or our medical industry. We're setting up a healthier, safer environment for them because we're all in. So you could sit and paint the worst case scenario of a virus spreading through an essential business. And every essential business is important to our city operations right now. But what the key component is for the rest of us to stay in as much as possible and create the safest environment for them to move about our city.
Our numbers are very, very low right now. So we only have 4 deaths. And so I think that so the numbers are very low. So I don't know that a lot of conclusions can be drawn from such low numbers. I think that every death is important. And so our hearts go out to each family that has lost a loved one. As far as the percentages and rates, with such low numbers, it's hard to draw a lot of conclusions. And so I think that that's the most important thing to take away is when we have low numbers, it's hard to draw those conclusions.
I think that we can look at other models, and I think probably we're a little bit behind, say, other models for the state of Texas, et cetera. I have seen those models suggest that the peak is going to be in late April, but there's other models that suggest even May. What we're seeing here in Amarillo, I think it's important. What Dr. Weiss and Lamentier are observing, we're seeing cases, but we're not seeing huge increases in cases. So it's I think that's really important that to keep that in mind. I don't know if anybody else had any other input about that.
I would just say the same thing. Is we've looked at a number of these different models, and as Dr. Milton has pointed out, it varies all over the place. And it's just tough because a lot of these models were designed based around some of the experiences in large cities, dense populations. So again, the question is, how much do they apply to an area like West Texas where you don't have people living on top of each other? So yeah, I think at this point, optimally maybe end of April, but I think into May is very possible based on some of these models.
Yeah, I would agree with that. And again, the model's only as good as the data that gets put into it. And one of the key variables is the social distancing piece, meaning you need to input a date through which you believe you're going to be socially distancing appropriately. And if you change that date, it changes the potential peak and overall number of cases. So again, I think what we're seeing here thus far is the result of some of the activity that we've appropriately done in terms of shutting down some things that need to be transiently shut down.
I have to agree with the good docs is that the models are all over the place. And some of the internal VA models have been very different than some of the state models, for example. And so at this point, it's looking like maybe the mid to latter part of this month, but it's yet to be determined.
So when we first opened, we certainly had higher numbers, but we have plateaued and are seeing very steady numbers. So we really appreciate our community for coming and calling to be tested.
I would just say
I would say, go ahead, Brian. I'm sorry.
No, that's right. Just I would say very similar. We're still only testing symptomatic patients, but the good news is it seems our percentage of positives has not gone up since we began testing. So again, just this kind of slow smolder of positive cases, but we're only testing symptomatic patients.
I would agree that the overall percentage of positive remains low. Looking at our numbers today, and I got our updated spreadsheet, we're about 9% of all of our tests that we performed are positive. I will say that it looks like we've had 6 new positives since Monday, which is a little bit interesting. All of those appear to be outpatients. So again, we are not at a point where I believe, or I think any of us believe, that we should be letting up the reins on what we're attempting to do to mitigate this disease.
Very similar as both Dr. Weiss and Dr. Lamentier mentioned, here at the VA, we've tested approximately 40 or so veteran patients of ours, and we've only had 1 positive thus far. We're hoping it stays that way, but for the most part, we're also moving aggressively to have a baseline testing of all of our nursing home veteran patients, veteran residents, and staff who are supporting that nursing home as well. That's something new that's coming out today that we'll be aggressively working on.
Brian, want to go first?
Sure. So we have had staff members test positive, no more than a handful, thankfully. We've had a number that have shown symptoms for different things that we've tested that have turned out negative. So far, it is a vast minority of our staff that have tested positive.
I think we are exactly the same boat as Northwest. At BSA, we've had several staff members test positively. That's a very small number. There is a process by which we reintroduce people back into the workplace, which involves detailed testing. I'm working on that with the other CMOs across our system to try to use national standards of how we do that. But again, it's a very small number of patients. I think that we will attempt to continue to be as diligent as possible with any type of even minor exposure. We're being very conservative in putting people in quarantine. When I say that, it has to do with the amount of PPE someone has on, or if the patient was receiving an aerosolizing procedure that was necessary. So we go through excruciating detail to determine whether or not someone may have been exposed, even with a low risk. And then we often will quarantine if we feel like there was any risk.
You know, at VA, we've had quite a few negative results from our workforce, but we've only had one medical resident and one employee test positive thus far.
I think that the number of calls we're receiving is purely a function of people are moving around less, they're going to work less, they're going to shop less, they're staying home. So there's less activity, therefore less accidents, less interactions that lead to crimes, things like that. So I think it's just a function of people staying in.
Thank you, Kaylee. We have one more media member. I just want to make sure we don't miss anybody. Do we have a representative from KVI Channel 7 who wanted to ask any additional questions? Going once, going twice, going 3 times. That was all of the questions we had for today from our communications department and from our media. Once again, we do these news conferences 3 times a week, Monday, Wednesday, and Friday at 11 a.m. We want to thank all the panelists who take the time out to participate in these 3 times a week. We appreciate your input. And once again, we will be able to see everyone again on Friday at 11 a.m. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to thank everyone for participating and watching. Thank you.
Thank you.